The honourable member for Elmwood-Transcona.
Well, thank you very much, Madam Speaker. I appreciate that. I'm very pleased to rise today to participate in debate on the Budget Implementation Act. It's an act that comes at a time when the country is facing a lot of challenge, and we've spent a lot of time. I wonder, Madam Speaker, if I might just wait until a few members of...
Yes. Could we ask the honourable members to take conversations outside the House, please, the chamber, and go to the lobbies? Est-ce qu'on peut demander aux honorables députés...
Can honourable members please take their conversations outside?
Can we have some order, please? The honourable member for Elmwood-Transcona.
Thank you very much, Madam Speaker. And I am pleased to rise and participate in the debate on the Budget Implementation Act today. I might start just by saying that I'm wearing this flower here to mark MS Awareness Day, as many members, indeed perhaps all members, were doing today in the House, which I think is a great thing. And we're discussing the Budget Implementation Act at a really challenging time for the country. This won't come as news to members in the House, just as it won't come as news to people across the country who are living that very experience. But I think it's important to talk a little bit more about what some of those issues are that are facing people. As we come out, we hope, of the pandemic, our lives are still very much affected by what we've gone through and what we continue to go through. And certainly if you look at our healthcare system, for instance, Madam Speaker, the effects of the pandemic are still very much real and very much at work. Even for those who aren't in hospital as a result of the pandemic or who aren't hospitalized with COVID-19, a lot of Canadians are dealing, either themselves or family members or friends, with people who are trying to access medical services and are finding it difficult to do so because our healthcare professionals are simply exhausted after having spent the last 2 years working so hard to try and save the lives of Canadians who have been affected by COVID-19, and now trying to address the backlog of medical procedures and diagnostics and other types of care that has accumulated over the course of that pandemic while our hospitals were full with extraordinary numbers of people sick with COVID-19. So we're facing real challenges on the health front, not only trying to figure out how to deal with the problems that still exist, but also, I hope, and it's certainly the case for New Democrats, that we want to figure out how we can create a silver lining in all of the pain and the hurt and the challenge in healthcare to try and come out of it with a stronger public health system that is going to serve Canadians well into the future, and also one, I might add, that can be run more efficiently in terms of finding ways to save money, not by cutting services to people who need it, but by exploring new ways of delivering services to people that need them, that contain efficiencies in them. And I'm speaking, of course, of Pharmacare and having a proper national Pharmacare plan that can save money while serving more people. And there are a number of studies to show that this is very much possible. And when you look across the world, you'll note Canada is one of a very few countries with public health care on a national level that doesn't have a national drug policy and a national drug insurance plan. And I don't think it's a coincidence that we also pay among the highest costs for prescription drugs. It's because we're not mobilizing our purchasing power through the power of a national prescription drug plan. And so that's one example. Another example, Madam Speaker, is investments in things like dental care, because we know that good oral health helps prevent other kinds of health issues that can occur down the line. And so investing in something like a basic dental care plan means investing in the future and heading off health problems that will not only make a difference in the lives of Canadians by increasing their health, reducing their sickness. It will help avoid human tragedy, but it will also cost less in the long run, because we know that when we allow health problems to get to the point of crisis, they're far more expensive to fix. So that's happening in healthcare. In the economy, we're facing a whole other set of problems. We're facing a situation where we've talked a lot over the last couple of years about people being out of work as they were, and they needed support from the government while they were out of work. Now we're in a phase where there are still people struggling to get into the workforce. You can go out and you can talk to them. There are people that are trying to maintain their business. I'm thinking of folks like the independent travel agents, an industry that's made up of about 80% women who are still trying to hold their business together, deal with their clients, aren't getting paid because they don't get paid until well after the trip has been taken. And of course, there's still a lot of uncertainty with travel rules, not just in Canada, but across the globe, that are making it still difficult for people to travel, and therefore difficult for people in that industry to make their money. But the tourism and hospitality industry is a really important industry in the Canadian economy. The numbers from before the pandemic show that very well, and the people who have the skills and the training and the networks to be able to deliver good service to Canadians within that industry are people that we still want to have available to work in that industry when the pandemic is truly behind us. They're going to need some ongoing support to be able to do that, just as people in the arts and culture industry ont besoin de l'aide. Puis en
They need help. And in December, the government did talk about people who work in the arts sector and even negotiated a solution with the Bloc Québécois. But we're still not seeing a program to offer financial assistance to people working in the arts and culture sector. Just as we don't see financial support for people working in the tourism and travel sector.
Work to do coming out of the pandemic for people who are still suffering negative economic consequences. At the same time, unemployment has gone down significantly, and we hear from employers that they're looking for people to work. And so we have this awkward situation of some people being in very difficult personal economic circumstances because their kind of work, the kind of work that they're trained for and that they have experience with, hasn't come back, even as their employers in very different industries that can't find people to work in their business. And I would say, even though I'm still kind of trying to give a little bit of an overview of some of the problems we're facing, that there is definitely a role for government there. It's why the reforms to employment insurance are so important right now. They're important in part to be able to provide financial assistance to people who are still struggling. And I think we do need some supplementary income assistance programs beyond employment insurance reform, but certainly those reforms are very important to have in place, just as they were over the last number of years in order to support people. But there's also a role for government to get involved in hooking up those people who are struggling to find work with the employers that are looking for workers, and to provide the training that has to happen to transition people from one sector into another. That's true because of the ongoing economic consequences of the pandemic, but it is already true, and it will be more and more true as climate change changes our economy and affects our economy and affects the workers who are at the front end or on the front line of that transition. And they're the people most at risk of falling through the cracks. I don't think we really believe, I certainly don't believe, I don't think my colleagues in the NDP believe, that the banks are going to somehow slip through the cracks, or that big multinational investors are going to get forgotten and not know what to do and be left on their own to try and figure out how to find their place in a changing world. They will be well served. They are well served. In fact, too well served by institutions that should be looking to serve all people, including the workers who are on the front line. And that's why we're going to continue to be a voice to say you can't just be happy that the banks and the big institutional investors are taken care of. Thank you very much. You have to make sure that the people who work for them and who produce the wealth that those companies enjoy are also taken care of in that transition. Not just because that's morally important, and it is, but also because that's how we're going to help those other employers that also want to have successful businesses and that also represent Canada in the world stage of business, who need talent to be able to carry on their enterprise successfully. And so there is a real role, I think there always has been, but ever more so now, for government to get involved in training and making sure that the right kinds of training are available to particular workers for particular employers and making that strong connection. So we're not just saying to workers, well, let's wait until you lose your job to help you find a solution. Then we're going to direct you to some general training where there's some signals that there's, some promising hope for you in a particular sector, and then you'll do the training, and then if you don't get hired, that's your problem. What we want is a government that identifies the employers who are really looking for work, that have a promising work forecast and a good business plan, and say, we're going to work with you to find the workers that you need for your business to succeed. We're going to have them do the training knowing that there is a good job on the other end of that training, so that both employers and workers can transition, whether that's transitioning out of the pandemic or whether that's transitioning through the economic challenges of climate change, to make sure that Canadian businesses are successful and that Canadian workers have the opportunity to share in that success. So that's part of the economic challenge. That's what we call, the kind of workforce issues that we're facing as a country. But we're also facing those challenges in the context of high inflation that's really putting the pinch on households. Again, I talked about the importance of supporting workers through that transition, both with training and with income, so that they're not leaving their family in the lurch while they try and get that training for the promise of for the promise of that new job. But all the more important because inflation is eating into the household budgets of Canadians, even as we try and navigate these very challenges. So I don't think I need to talk a whole lot about the inflation problem, in the sense that it has been very well examined in this place and no doubt will continue to be. So I won't go over all of the issues that have to do with inflation, but the point that I want to try and add, and I feel a duty to do so because you don't hear much about it except from this side of the House, is the role that we're hearing that corporate profiteering has been playing in inflation as well. There's been some studies out in the last month that suggest up to a quarter, or 25% of the inflationary pressure that Canadians are experiencing in their household budget are having to do with price increases that go above the increase in costs that companies are experiencing. So it's not just a matter of companies passing on the increased cost to their customers. We're talking about huge profit growth. I think, if the kind of general number pre-pandemic, I think, was around 9% for profit booking overall in Canada, it's gone up to 16%. And that's the profit, which means that's what's left over after costs are subtracted from revenue. And that means that in some industries, some companies certainly are making a lot more money. It's not just that they're passing on their costs, it's that they're spying an opportunity to make more money on the backs of Canadians that have already been through hell in the last 2 years and are still going through a really difficult time. That should also be the focus of people in this place, not just the actions of government, not just what government has done that may have contributed to the problem, but what government hasn't done to get a handle on the situation. And that is nowhere more true than in the housing market. That's true in the housing market over the last 2 years, but it's also true in the housing market for decades now. Under governments of both stripes, both Liberal and Conservative, we've seen incredible increases in the cost of housing. I heard a Conservative MP in response to another speech I made in this place not that long ago, Mr. Speaker, try and downplay that and say, well, actually we had, there's always been increases in the cost of housing, and that's quite normal, and it wasn't that bad. Well, I would call that a kind of goldfish politics, Madam Speaker, and one that I think it's important for Canadians not to buy into. Canadians are well served when they and their politicians have long memories about what has happened. And if you look at the trend line for house prices, they've increased significantly in this century, year over year over year, and that has accelerated in the pandemic, to be sure, and there are reasons for that, some of which have to do with those very companies that I was talking about that have been amassing a fortune and trying to figure out how to put that money to work for themselves by making more money and finding that the real estate market is a great way to do that. And that's why it makes sense for government to step in and to say, when we're talking about the residential housing market, you can only treat it that way to a point, because we're not well served. Individual Canadians are not well served. Our economy as a whole is not well served. we're not well served as a country when we allow the places that we depend on for shelter and to build our homes to be treated as an asset commodity. And more, that's what's been happening. The numbers tell the story. Something like 25% of CMHC mortgages in the last year or so were for investor properties. That's a record number. It's never been like that before. It's never been like that before. And it calls for a response from government. It's the government that sets the rules for the CMHC around their mortgage insurance policy. And I think we have to be asking why it is that in this context, we would be content to allow investors to get the same treatment to de-risk their mortgage investment as somebody buying their first home. That doesn't make sense. I don't think it was captured 20 or 30 or 40 or 50 years ago because investment activity didn't play the same role that it's playing in the market today. But given what's changed in the housing market, we have to be asking those questions. We have to be asking why it is somebody can be just producing the same amount of cash up front for a down payment for their 8th home as they do for their first home, and whether that makes sense or whether we're going to ask them to do more in order to temper the effect in the market. It's hard to move housing prices down. It's a difficult policy area, but it's why it's that much more important that we get to work on it. We're seeing the role of real estate investment trusts in the market grow. And I think it's fundamentally unfair to say to Canadians, if you're going to buy your first home, you're not just going to compete with the family down the street or somebody from across the city who's thinking about changing neighborhoods, or maybe somebody who just got a job in your city that's coming from another Canadian city. You're going to compete with some of the corporate entities in Canada that have some of the deepest pockets that want to beat you on the bid and then rent it back to you at extraordinary prices. That's not a fair competition. It's not a competition at all. In fact, Canadians can't be expected to compete with deep-pocketed corporate investors to buy a home. That's ridiculous. And so we have to find ways to change the rules of the market so that Canadians aren't put in this impossible position anymore. It's getting more and more impossible. The good news is that these are things that are doable, and whether we're talking about changing the terms and conditions for CMHC mortgage insurance for investors, whether we're talking about escalating the amount that you need for a down payment on subsequent properties, whether we're talking about a moratorium on real estate investment trust activity in the market, these are all things that don't cost the government a dime. They're not going to be enough on their own because we do have to address the supply side of housing. But these are things that the government can be doing to temper the rise in house prices over time by targeting the investment activity that has been driving up those prices that don't require spending money. And I think that's a real virtue. I think government should be looking for solutions to problems that aren't just throwing more money at it. There are enough problems where we do need to invest in order to get to the solution. On the supply side, we need to invest. There's no way you're going to augment housing supply in Canada without significant investment. When it comes to climate change, we are going to have to make some serious investments. There are regulatory things we can do that don't cost money too, but we're kidding ourselves if we think we're not going to have to make substantial investments in Canada's infrastructure in order to successfully transition to the low carbon economy that we need. So there are times when public expenditure is part of the answer, and there are times when you can pursue policies that can make a real difference that don't cost money. There are times you can pursue policies that save you money, and I think Pharmacare, as I said earlier, is an excellent example of that, where it's not about spending no money, it's about spending out of the federal government's budget instead of other governments' budgets, and out of Canadians' own pocket to overall spend less. But there are things we can do to combat the financialization of the housing sector that has created a completely unfair competitive landscape for Canadian families bidding on homes that won't cost the government money. So here we are. We're in this time of transitioning, we hope, out of the pandemic, of transitioning, unfortunately, into a far less certain future in respect to the climate and the economic uncertainty that will also generate. It's a time where we are going to need more public involvement in the economy, as far as I'm concerned, in order to do that well and to make sure that we don't leave people behind. So I would say, I've already spoken to the budget proper. I want to spend a little bit of time talking to some of the measures in this Budget Implementation Act. An act that I think, unfortunately does not have sufficient ambition. So I think there are a number of things in here that are good. I think they're a step in the right direction. But I don't think that neither the budget, and so perhaps it's no surprise that the Budget Implementation Act also does not have the appropriate level of ambition. But it is certainly the case that it doesn't. I see my 20 minutes are up already, and I was just getting to the act, Madam Speaker. I'm sure that the member from Sherwood Park is getting up for unanimous consent.
The Honourable Minister for Seniors, is it for a point of order or is it a question?
I have a point of order.
Point of order, Madam Speaker.
The Honourable Minister.
Madam Speaker, I'm tabling government responses to questions number 394 to 408. Thank you.
Thank you. The Honourable Member for Sherwood Park, Saskatchewan has a point of order.
Madam Chair, I'd like to indulge the Honourable Member by seeking the unanimous consent to extend his period for questions and comments by another 10 minutes, with the proviso that the extra 10 minutes will be allotted exclusively to Conservative members asking questions.
That's not a point of order that we are prepared to accept. Questions and comments. The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. And when I think of budgets, one can't help but think in terms of priorities. And at the end of the day, there are many wonderful aspects to the budget that will have a profoundly positive impact on Canadians. One in which that I am very much encouraged about is the issue of childcare. But there is something that I think that Canadians also, and the NDP, talk a great deal about it, and the member has made reference to it, and the idea of a national dental plan. And it's important that we recognize that it's being done in a staged fashion, where we're getting children being recognized first. It's an area in which I think is something that's long overdue, and if you want to provide some thoughts on that component going forward, and how important it is also that we continue to do what we can in the healthcare field, and I'm thinking in terms specifically with regards to pharmaceuticals.
The Honourable Member for Elmwood-Transcona.
Well, I thank the member very much for the opportunity to speak a little bit more to the importance of dental care. I think one of the things to keep in mind, and I had the opportunity to speak earlier about the health effects of getting good and timely access to appropriate dental care. But the other thing that it really does, we've heard stories in the NDP caucus about folks who have either felt embarrassed or who overcame some sense of shame about the state of their teeth to go to a job interview, and then felt that they didn't get the job because they didn't present that the way that they would like to present, or they didn't meet the expectations that others had for them in terms of what their mouth should look like to get a job. So it really does. It can impact people in the pocketbook, and it speaks to their sense of dignity. And I think that I look forward to the day where the country has experience with this dental care plan, where we've had the virtue of seeing friends and family and people in our neighborhood get timely access to dental care that they haven't always had, to see the difference that it really makes in people's lives. And I do believe that once we've had some experience with that, Canadians won't want to go back.
Questions and comments? The Honourable Member of Sherwood Park, Saskatchewan.
Thank you, Madam Chair. It was interesting to hear my friend across the way talk a great deal about housing, but not in any way talk about the problem of supply. The reason that we have such high housing prices in this country, I think a main reason is that there is a greater need for homes that is not met by the current supply. And all of his proposals involve creating more challenges and more barriers for investors. An alternative option is to create the incentives to make it easier for those investors to invest in new home construction. So to encourage those investments in new home construction. Because while there are many people that want to invest in housing, there are so many barriers in place that make it harder to bring new construction online. And those barriers aren't just at the federal level. There's a great deal of those barriers in place at all levels, Madam Speaker. How can we address the housing challenges and costs if we don't address that supply problem? And if we do address that supply problem, doesn't it make everything so much easier afterwards?
The honourable member for Elmwood-Transcona.
Well, I think the member must have had to go to the washroom or something in the section of the speech where I said that the measures I was talking about today specifically would not be adequate without having a way to address the supply issue. And of course, I don't believe that simply making it easier for developers to create more expensive homes is going to get us out of this problem. I think that we do need targeted investment because we need suites that people can actually afford to live in. And so that's why we need cooperative housing. It's why part of the deal that the NDP cut with the government included investment in co-op housing, and you can see that in the budget. It's why we believe we need to be building social housing units where rent is actually geared to income. Those are ways of relieving some of the strain on the housing market as well, and I'd be very happy to have a debate on what we can do on the supply side as well. I just couldn't fit it into all of the 20 minutes. He'll note I didn't say no to his request, incidentally. Another member said no to his request. I'd have been glad to have taken him up.
Questions et commentaires. L'honorable député.
The honourable member for Beauport-Limoilou. Thank you, Madam Speaker. You know, a person's teeth are important. They're important for digestive health and for self-esteem. And dental insurance is something we're not against, but we want the right to opt out with full compensation for those provinces who want to create their own insurance regime. My question is, for my colleague, would it be possible to include such a clause in C-19? The honourable member for Transcona. The NDP has always been clear for Quebec, given historic and cultural reasons, there should be a right to opt out with compensation. So that's already part of our plan. Absolutely, no question, since the very beginning. Thank you.
It's the honourable member for Powell River, North Island Powell River.
Thank you, Madam Speaker, and I thank the member for his excellent speech and really wish that we were in this House talking about an NDP budget, because I think listening to his speech, many Canadians understand a total different view that would be happening in this country if we had that. My question to the member is specifically around housing and non-market housing. I'm working with many constituents in my riding who have lost their homes. They cannot rent because they're getting rent evictions. We have a lot of people moving to our riding, buying up houses, pushing the market up so high that people can't even dream of buying a home within their own community anymore. And what we don't have is affordable housing, market housing, that would let them actually have a place to be safe. And I'm just wondering if he could speak about how this government could do so much better if they would actually take action. Thank you.
The honourable member for Elmwood-Transcona.
Sure, well, maybe I'll just start with one specific example. There's a lot of co-op housing and other types of non-market housing that had been supported by the federal government under operating agreements for decades, but those operating agreements were tied to their mortgages. When those started to expire under the Harper government, those agreements weren't renewed. There was a promise by the Liberals to renew those agreements, but they were never renewed under the same terms and conditions. I don't think it was a success. Part of the problem actually is investors in some cases are moving in on those very properties when the board comes to the conclusion that they can't manage that non-market housing with the lower rents in the absence of that federal operating funding, and then that makes them a right target for something like a real estate investment trust that says, oh, here's a bunch of units we can get on the cheap, we'll throw a little bit of money into it, fix them up, and then rent them out at much higher prices. That displaces all the residents that are there. That's just one example of where poor federal policy under both Liberals and Conservatives have contributed to the depletion of affordable non-market housing units. Keeping those units is part of addressing the supply problem. If we're losing more units than we're building, we can't get ahead.
For another question, the honourable member for Sandwich Gulf Islands.
Thank you. And my honourable colleague from Elmwood-Transcona, I want to thank him for a very thoughtful speech addressing Bill C-19, the Budget Implementation Act. In his speech, obviously housing is a very attractive topic. I want to dive in, but he also talked about labour. And I'm particularly interested in changes in this Budget Implementation Act around seasonal workers and employment insurance. I don't know if he's prepared to comment on it, but we went through a period under the previous Harper administration where seasonal workers and routine unemployment was treated as sort of recidivism and shouldn't be allowed and should be punished. It seems to me that Section 27 of this, Division 27 of the Act, is opening up again the idea of regional unemployment pockets where the length of the weeks that you could get employment insurance would reflect regional unemployment, but I'm not certain because we haven't gotten it to committee yet to study it. What's his take on Division 27 of this Act?
The honourable member for Elmwood Transcona.
We are in the early days of study of this bill, but my initial impression is that it is extending a pilot program that was meant to help cover off some of those gaps that exist. I think the issue there is that we do actually have a fair bit of experience with this pilot program now. So the question is, why can't we actually get to a permanent solution? We have a solution that's kind of de facto permanent as long as the government is willing to continue extending the pilot program. But I think, seasonal workers in places where that is the established work culture, and in fact the work's just not available outside of the working season. I come out of the construction industry where we say bake hay while the sun shines, and so you do. But I don't know why we can't get to the point where we can offer these workers a little more certainty about what their lives are going to look like by making permanent a program that the government has been very clearly willing to extend indefinitely.